Doxepin Hcl is used to treat mental/mood problems such as depression and anxiety. It may help improve mood and feelings of well-being, relieve anxiety and tension, help you sleep better, and increase your energy level. This medication belongs to a class of medications called tricyclic antidepressants. It works by affecting the balance of certain natural chemicals, neurotransmitters, in the brain. It is typically taken orally, usually 1 to 3 times a day, with or without food. The dosage is based on your medical condition and response to treatment. It is best to take this medication at bedtime or as directed by your doctor. Are you taking Doxepin for the first time? Remember to read the medication guide provided by your pharmacist before you start taking Doxepin and each time you get a refill. If you have any questions, consult your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually 1 to 3 times daily. If you take it only once a day, take it at bedtime to reduce daytime sleepiness. The dosage is based on your medical condition and response to treatment. To reduce your risk of side effects, such as drowsiness, dry mouth, dizziness, your doctor may direct you to start this medication at a low dose and gradually increase your dose. Follow your doctor's instructions carefully. Use the dropper that comes with the medication to measure out the prescribed amount. Just before taking, mix the drug with half a glass, 4 ounces or 120 milliliters, of water or milk, or orange, grapefruit, tomato, prune or pineapple juice, and drink all of the mixture. Do not mix with soda or other carbonated beverages. If you are taking this medication in combination with liquid methadone, you may mix both drugs with lemonade, orange juice, sugar water, orange drink mix, or plain water, but not grape juice. Mix only what you need for each dose. Do not prepare a supply for future use. Remember to take this medication regularly in order to get the most benefit from it. To help you remember, take it at the same times each day. Do not increase your dose or use this drug more often or for longer than prescribed. Your condition will not improve any faster, and your risk of side effects will increase. Keep taking this medication even if you feel well. Do not stop taking this medication without consulting your doctor. Some conditions may become worse when this drug is suddenly stopped. Also, you may experience symptoms such as mood swings, headache, and tiredness. To prevent these symptoms while you are stopping treatment with this drug, your doctor may reduce your dose gradually. Consult your doctor or pharmacist for more details. Report any new or worsening symptoms right away. This medication may not work right away. You may see some benefit within a week. However, it may take up to 3 weeks before you feel the full effect. It's important to tell your doctor if your condition lasts or gets worse, such as your feelings of sadness get worse, or you have thoughts of suicide. Some common side effects of Doxepin Hcl include drowsiness, dizziness, dry mouth, blurred vision, constipation, and trouble urinating. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. To reduce the risk of dizziness and lightheadedness, make sure to get up slowly when rising from a sitting or lying position. If you experience dry mouth, you can try sucking on sugarless, hard candy or ice chips, chewing sugarless gum, drinking water, or using a saliva substitute. To prevent constipation, it's important to eat dietary fiber, drink enough water, and exercise. You may also need to take a laxative, so it's best to ask your pharmacist which type is right for you. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people using this medication do not experience serious side effects. However, it's important to notify your doctor right away if you experience any serious side effects such as persistent heartburn, changes in mental or mood state, shaking, or severe stomach or abdominal pain. In the event of very serious side effects like severe dizziness, fast or irregular heartbeat, fainting, seizures, or vision changes, it's crucial to seek medical help immediately. While a serious allergic reaction to this drug is rare, it's important to get medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching or swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed here, it's important to contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA. In Canada, you can also call your doctor for medical advice or report side effects to Health Canada. When it comes to using Doxepin Hcl, it's important to understand its uses and potential benefits. This medication is commonly used to treat depression and other mental or mood disorders. It can also help prevent suicidal thoughts and attempts, which is a crucial benefit for those struggling with these issues. It's worth noting that while antidepressants can be very helpful, there is a possibility that some individuals, especially those under 25, may experience worsened depression, mood symptoms, or even suicidal thoughts while taking these medications. It's essential to have an open conversation with your doctor about the potential risks and benefits, especially if you're under 25. If you notice any worsening depression or other psychiatric symptoms, unusual changes in behavior, or new mood changes like increased anxiety or trouble sleeping, it's important to notify your doctor right away. Pay extra attention to these symptoms when starting a new antidepressant or when making changes to your dosage. As for the daily dosage and optimal timing of Doxepin Hcl, your doctor will provide specific instructions based on your individual needs and medical history. Be sure to follow their guidance carefully to get the most out of this medication. Before taking Doxepin, it's important to talk to your doctor or pharmacist about any allergies you may have, as well as any medical conditions you may be experiencing. This medication may affect your heart rhythm, so it's crucial to discuss any heart problems you may have or any other medications you may be taking that could also affect your heart rhythm. It's also essential to mention if you have low levels of potassium or magnesium in your blood, as this could increase your risk of experiencing heart rhythm issues. Doxepin may also cause dizziness, drowsiness, or blurred vision, and using alcohol or marijuana can intensify these effects. It's advised to avoid driving or operating machinery and to limit alcohol consumption while taking this medication. Additionally, be cautious of sun exposure while on this medication, as it may make you more sensitive to the sun. If you have diabetes, be aware that Doxepin may make it harder to control your blood sugar levels, so it's important to monitor your levels regularly and discuss any changes with your doctor. If you're an older adult, you may be more sensitive to the side effects of this drug, so be mindful of any symptoms you may experience. If you're pregnant or breastfeeding, it's crucial to have a discussion with your doctor about the potential risks and benefits of using Doxepin. Lastly, do not stop using this medication unless directed by your doctor, as untreated mental/mood problems such as depression and anxiety can be serious conditions. If you have any concerns or questions, always consult your doctor for advice. It's important to be aware of potential drug interactions with Doxepin Hcl, as they can affect how the medication works and increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist, including prescription and non-prescription drugs, as well as herbal products. Certain medications, such as thyroid supplements and central-acting drugs for high blood pressure, may interact with Doxepin Hcl. It's also crucial to avoid taking MAO inhibitors, as this can cause a serious and possibly fatal drug interaction. Additionally, other medications can affect the removal of Doxepin from your body, potentially affecting how it works. Furthermore, it's important to inform your doctor or pharmacist of any other products you are taking that may cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, other drugs for sleep or anxiety, muscle relaxants, or antihistamines. Be sure to check the labels on all your medicines, as they may contain ingredients that cause drowsiness. If someone has taken too much Doxepin Hcl and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include extreme drowsiness, hallucinations, fast or irregular heartbeat, fainting, slow or shallow breathing, and seizures. If you or someone you know is experiencing these symptoms, seek help right away. It is important not to share this medication with others. Your doctor may conduct various lab and medical tests, such as blood counts, blood pressure, EKG, and liver tests, while you are taking this medication. It is essential to keep all medical and lab appointments. Consult your doctor for more details. If you forget to take a dose of Doxepin Hcl, take it as soon as you remember. If it's almost time for your next dose, skip the missed one and take the next one at your usual time. Do not take a double dose to make up for the missed one. Remember to store Doxepin Hcl at room temperature, away from light and moisture. It's important not to keep it in the bathroom and to keep it out of reach of children and pets. When it comes to getting rid of this medication, don't flush it down the toilet or pour it down the drain unless specifically instructed to do so. Instead, make sure to properly dispose of it when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.